all. This is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. I hope you had a great weekend and I hope you enjoyed the Super Bowl. Who was happy and who was not? Tell me. So I believe Tom Brady won once more. So hopefully that is a fun news to have. Okay, so let's start. There are lots of Twitter questions that are still left over. So I'm just going to go over them and then I'll keep tossing back and forth here. Michelle says 40 people waiting already for this brilliant position that shares his intellect, expertise in teaching. God bless you. God bless you. Thank you very much, Michelle. Thank you very much for being here. This is just all of us together, learning together. Charles says, hi, Dr. Bean, my medical guru and all the cool beans. Hi, Charles. Welcome. So, oh, wow. Greenheart is from Dubai. Wow. Welcome. Cat Scratch says, oh, man, forgot my beer. Okay, so France is here. Now we can start. Jim is here. Absolutely. Margaret is here. Margaret, thank you very much. Your generous donation, it always warms my heart. And thank you. Thank you very much for that. All right, so let's start. Jim is here as well. I wonder where is Japan? I haven't seen Japan for some time. And logic comes and goes, right? Alexander Vasaras is here as well. So Alexander is a doctor from Greece. And today we were talking on through the Facebook, we were talking about hydroxychloroquine and the knowledge that it was known that hydroxychloroquine was a solution. So if I can very quickly share some of the things that the basis of the discussion that Dr. Vasaras and I had. So if you say hydroxychloroquine is a potent inhibitor of SARS, so Luffy's here. So if you see, this is a 2005 article published. It was published in Virology, which was, so Dr. Vasaras, tell me if I'm correct. So Virology at that time was running, or it is maybe still running under NIH, and Fauci was the head. So he must have known whatever is the situation. But here is a 2005 article which talks about, here, check this out. In addition to the well-known function of chloroquine, such as elevation of endosomal pH, the drug appears to interfere with terminal glycosylation of the cellular receptor, angiotensin-converting enzyme 2. And I have talked about these. I've actually talked about 5 mechanisms. So here there was a conclusion that chloroquine is effective in preventing the spread of SARS-CoV in cell culture. This is 2005. So not an old news. And so Dr. Vasaras was kind of bringing it to the light once more. And it is kind of unfortunate that hydroxychloroquine, ivermectin, vitamin D, these kind of things were not promoted more. And as much as I'm not a conspiracy theorist, I still feel that there was something that was not right in not promoting these things. Okay, cool. So ready, everyone? So the Shri says, good morning. I saw salam from someone here as well. Things just scroll fast. All right, let's start talking and looking at the Twitter as well so that we can plow through those things as well. So let's do it. Simple Living says, doctor, is there any way I can speak to you? We are speaking right now, Simple Living. You can tweet at me as well. There is a Twitter address, Dr. Bean Medical, and then we can talk more. Okay, so let's start. So here is DrBeen.com, and then this is the Twitter thread. I think we had talked up till here, Jim Walker's question about new onset IgGs and Puya's question about antiphospholipid antibodies. There are some more questions above that I had touched, and they just kind of readjust themselves. So here, let's just continue. Michelle says, hi, Dr. Bean. This was at the end of your February 4 question and answer. Please respond. Michelle, vaccines are genetic testing. I think it was from a Looney Tune from your question and answer on YouTube after I said I was going for my second Novavax February. So Michelle, I'll have to listen to this one again. I tried to go find it and I could not. So maybe tweet at me once more with some specifics so I can actually figure out what we are discussing. Susan says, question, can you address the nursing home deaths post-vaccine? So I talked about that yesterday or last working day on Saturday. How do Fluvoxamine works and helps COVID patients? So that is another discussion that I did that day. A very quick, brief summary of how Fluvoxamine helps reduce the symptoms. So I don't think that Fluvoxamine is great in curing or healing or preventing COVID, but one of the COVID symptom can be brain fog and confusion and depression and emotional instability and tiredness, and Fluvoxamine is seen to help with that. If I can read it, I hope Dr. Drew does not mind it. If I open up his messages that him and I were talking about, I hope he would not mind. So he said, Fluvoxamine has been very helpful. But I forgot to tell you, I was getting enormous relief from one glass of white wine. So that is one. Then he said, for Fluvoxamine, so far, Fluvoxamine amazingly stopped the tinnitus within 30 minutes. For 3 hours after each dose, energy just improves. And then sigma-1 agonists shut down inflammatory response as well. So pretty interesting. So he has seen that Fluvoxamine works very well as well. Okay, so that is about Fluvoxamine. Last discussion, we talked more. I think I'll do a complete separate topic about that as well, but generally it does help. Then Stang 352, post-COVID infection 2 months ago and now smelling. So we talked about this as well, phantom smell last time. Bart Brown, how many more hours before leronlimab? We talked about it as well, and I showed you a discussion of 6 clinical cases. That is what leronlimab is now kind of bringing out and saying, hey guys, look at this. So hopefully they will have an approval. Kyler Falcon says, what do you think about the MMR vaccine used to combat SARS-CoV-2? And so the link that we have here, so this is the Fluvoxamine, and we talked about it. This is Cytodine. Just once more, this is the link about MMR. And so this is more of a opinion piece with some data that is collected by these authors. And they have kind of made a case that it is possible that MMR vaccine, because these viruses are also of RNA type, and they have spike proteins as well that are 34% similar to SARS-CoV-2. So there is a possibility that MMR vaccine is helpful for SARS-CoV-2 as well. I have to kind of go through this data a little more. This is a good opinion piece. I like it. But without data or trial, they refer one study, but that study does not show significant results. Day McToto says, dear Dr. Bean, I used a wrong word about you the other day. So I had actually forgotten. So I had to kind of think about it. What was the wrong word? What I meant was your biochemistry is excellent. I'm sorry, I have poor English. No worries at all. I believe when you wrote this, I had to kind of think about it. So that was that you had said your knowledge of biochemistry is unremarkable. Totally fine. No worries at all. So, but thank you for the comment here. Day McToto says, I have a question though, doctor. If a person is immune to COVID-19 due to vaccine or past infection and spent more than 15 minutes with an infected patient in a room without a mask, will he still be able to infect others with the virus from his respiratory tract and nasal passages? Good question. And let me explain that. Scott says innate arm with IgA should stop, are not in its tracks. Kind of. So Scott, you are correct. You're on the right track. So let's just very quickly look at it. IgA for sure. So here is what will happen. A person who has been vaccinated or who was previously infected and has the antibodies. In that case, what would happen is that as the virus appears in their, let's say, in their mouth, as the virus arrives here, what will happen is that the IgA present here is going to neutralize it and bind with it. And number two, the local immune cells. So there are going to be a lot of immune cells, B cells and T cells. They are present all around the pharyngeal areas. So these cells are sitting there like gatekeepers. Tonsils were part of that, but once we become adults, then tonsils do not work that much. But we still have a lot of lymphoid tissue here, which has cells that are, whose function is to look at pathogens in the food and react to them. So of course there are going to be B cells, T cells. They would do their function as well. Of course, they're going to be innate arm cell as well. Innate arm are usually not as aggressive because their training or their memory is not very robust. So it is mostly the IgA that would help. Now the question is, imagine when the virus is here. To reinfect someone, you have to throw out a significant amount of virus. And if the person is immune, then the virus is going to find it hard. So if there is a cell here, and we make that cell bigger here, so the virus is going to find it hard to enter their cell, then replicate, come out, and then go to the next cell and then come out. That whole process will be hindered by the immune system's reaction to the virus. But that can take up to 24 hours. So normally immune system can take up to 2 weeks or more, but in case of a vaccinated or previously infected person, the immune system would start responding within 24 hours. So that means you still have 24 hours for the virus to kind of enter the cells and replicate and then go out. I don't think that the load should be sufficient enough to make others sick. Remember that the virus has to continue to replicate and increase in number for 4 or 5 days before we can start shedding it. So the shorter answer is that the possibility is that this will not happen, or it will be very less of a load of virus. Good question. Rima says, if a person got Moderna vaccine, first dose, and then 10 days later got COVID-19, and they start outpatient protocol of eye mask, which has changed since December 2020, or 2 doses of Ivermectin, enough if they get better. Assume the Moderna and their immune system will start kicking in soon. Correct. So if you started, or if a patient started eye mask while they were on the vaccine and there is just 1 dose, then yes, whatever the ivermectin or hydroxy or other things that are prophylactic, their function will still be available till the second dose comes in, and then a few days after the vaccine's whole potential is realized. So till that time, yes, ivermectin-like things can be taken. Janet says, love your videos. I have shell, fish, egg, chicken, and mold allergies. Should I get the J&J shot or wait for Novavax? So we talked about it last time as well, that both the shots. So Novavax is still not given in mass, number one. And number two, their phase 3 trial results are not out yet. So we do not know exactly how allergic they, or how many allergies they might cause. Because I was looking at the Novavax vaccine components, and if you see here, this was, so somebody, there is another Twitter question here about the Novavax using matrix M. So let me just quickly show that. Here, if you see, this is the matrix M adjuvant that is used in Novavax, which is actually a surfactant-like thing. It's like a soapy thing. And that is part of their vaccine, and that is a toxic thing, and it's an irritant. So can that cause its own reactions? We'll have to see. So because we do not have the trial result, for me to say wait for Novavax will be unfair. J&J's results are kind of coming in, interim results, so they sound okay, but still we do not have the elaborate results yet. So both of them are yet less known. J&J a little more known than Novavax. So to answer your questions, cannot say yet that which one is going to be better. Pam West says, I have the book Chronic and is a good read. I wonder if bacteriophage treatment towards the spirochetes might be more effective than antibiotics. I have been interested in the emerging in the US bacteriophage development and wonder if ivermectin interferes. So first, I don't think ivermectin interferes. And secondly, it will be an interesting thing, slightly different topic. So maybe one day we should talk about this as well. And Beanie Arun says, what is the author? Stephen Phillips. Yes, I think Pam is talking about Dr. Phillips's book. Honor UKB says, are peer-reviewed submissions expensive? Please also thank you for all your education. This is a very good question. So let me show you. Number one, yes, submitting your study does take money. So let me show you what kind of money. So here, this is and all of these links are in the description. So do I have to pay for submitting an article to a journal regardless of whether it is accepted or not? Normally, they would charge you when it is accepted. So here there are some answers. Then if you look at, for example, this is BMJ, and here is their fee. Published in the BMJ. The BMJ, our flagship journal, charges an APC, which is the processing fee for their approval processing fee, £3,500, exclusive of VAT or other. So other than taxes, £3,500 is BMJ. If you look at the Lancet, for example, their APC, the processing fee they have, I think is $5,000. Submission fee online, the Lancet, somewhere in here, you would see $5,000 as well for the APC. Yeah, here, article processing charges, APC. So if you see here, 5,000 upon acceptance of submitted research. So they would charge you when your research has been accepted, and the fee is the processing of the acceptance. If they did not accept it, then they will not charge you. So one more question here, and then I'll come to the live site. Baxter B. Bear says, calls for easier access to ivermectin as black markets thrive. So I have that open over here, and this one. And this is the sad part. Same thing as we talked about with the Dr. Vasara's message about hydroxychloroquine. Here with ivermectin, a similar behavior. Although I feel that now doctors should be able to, at least in the US, they should be able to prescribe it with more freedom because NIH is not against it anymore. But still, this issue just continues. And I don't know what is up with the medical community, that they cannot do their own research, and they somehow feel that it should just reveal, the knowledge should just reveal onto themselves, and if it has not, then they would not accept it. We all have to go do our research. Look at all of us sitting here. What are we doing? We are actually researching. So somebody is saying, Roller Girl is saying no audio. Are you able to hear me, or am I going on without audio since then? Okay, so hopefully we have audio. A few folks are saying they can hear me. Okay, very good. Thank you. So that is the discussion there. Let's look at some of the comments here. And Cher, I saw your, Michelle, I can hear you loud and clear. Thank you very much. Cher, I saw your email as well. So no worries at all. You were not in trouble. I was just joking that day with you. Okay, questions. Question. So Walking Tall has a question. Dr. Bean, have you covered the experimental COVID drug cures 30 out of 30 moderate to severe cases of phase of clinical trial in Israel? So I actually looked at ExoCD24, 30 out of 30 correct, but I didn't see any clinical data yet. So I am actually waiting for it. That is how actually Dr. Vasaras and I started talking as well. Dr. Nadir Abrar from Israel, I think. He has the possible cure. So I need some more data. But I did talk about it last time. Westfield said, question, are these mRNA vaccines very pro-inflammatory and therefore some can die from inflammation causing strokes or MIs? No. So vaccines should not do this. It is possible that some vaccines would cause allergic reaction in some people. And once again, for allergic reaction, so let me back up for a second. There are two known issues now at this time with vaccine. One is the side effects: fatigue, myalgia, nausea, vomiting, diarrhea, these kind of things. Not in everyone, but yes, these are present. And we saw that in very old folks who cannot take, let's say, vomiting and diarrhea, they're already very fragile, they died because of those side effects. So that is one way vaccines are causing harm. The other way is that some components of the vaccine, for example, polyethylene glycol, or for example, in case of Novavax, the saponins or soapification molecules, these can cause reactions as well. They do not cause reaction in everyone. Not every one of us is allergic. 20% of the population is allergic to various things. 80% of the population is not. So some of the vaccines do have components that can cause allergic reaction. Now, based on how severe the reaction is, a person can be in a deeper trouble. And then finally, I would add one more part to it. And that is, for example, the doctor from Florida who had the idiopathic thrombocytopenic purpura, or the bleeding disorder that occurred after vaccine. Although vaccine people came back and said, not us, but he never had that before, and it started occurring after the vaccine. So in my opinion, this was something to do with the vaccine. And vaccines are known to cause idiocytopenic purpura in the past. So to answer your question, it is not that the vaccines are pro-inflammatory or messenger RNA vaccines are pro-inflammatory, but it is possible that vaccines would cause allergic reaction in some people. Yes, Wayne, we talked about it last time as well. I shared the link too. We just need a little bit more data to talk about it. Looks promising. Wow, Cher says, looks like it will be my turn in vaccine for July. Dang, that's a long way. Yes, that is a long way. Barbara Warren, I saw a question from Barbara. DrBeen Medical Lectures. Merck, actual producer of Ivermectin, is now questioning safety for use for C19 when they have produced excellent safety of use for use with parasites for decades. That is correct, but let's be fair to them. Although Big Pharma is usually less needy of being fair to them, they're usually not fair in return. But the Merck's usage of Ivermectin was once in a 3 months or once in a 6 months or once in a year. We are trying to use this drug on daily basis or weekly basis or bi-weekly basis. So that is something that they do not know. And so I have always repeated it as well, that usage of Ivermectin in this frequency is not known. So there may be side effects. TL10 Selsky says, question, is Singular good for long haulers? Will it diminish my immune system? So I can't talk to a specific situation, but let's see. Singular Montelukast, anti-allergic. So it has a boxed warning on it. So it has its own boxed warning on top of it. It will not help with the long hauler in general. I can't talk about your situation, but those things that would only reduce some symptoms will not actually cure long haulers. The reason that steroids have a chance of improving is they shut down the immune system for some time. And so that allows the immune system to reboot, and it possibly reboots correctly. I had tweeted out this weekend that there are, UC Davis had said in their article that there are two theories for long haulers. I think that they heard my talks. They said there are two theories for long haulers. Either the virus is persisting or the immune system has gone dysfunctional. Although they did not know that I have actually moved on with more theories. So I tweeted that they are stuck at two, but I think there are more. For example, there is the mutation in the cells, virus still sticking out there, the immune system forgetting to shut itself down, or the, what is that? The dysregulation because of one more immune system mechanism. I had written them down. So I thought I would do those, that topic separately. So long hauler, I think LTs for that. I'll talk about the long hauling this tomorrow or day after. This is very interesting. John says, texted with a friend living in Mexico. She said that the authorities are recommending ivermectin. I Googled it and it's true. And that is excellent. Dr. Vasara says, if we have some human cell components in the vaccine, could we have recognition of these cells as foreign bodies and produce antibodies against them, but in this way initiate autoimmunity? Very good question. If we could initiate autoimmunity this way, then people would develop autoimmunity to blood transfusions and other such things. We would initiate immunity against those cells and destroy them, clear them, and be done. Normally, that does not start autoimmunity. There is a, I think you know it, you're a doctor, there is a graft versus host relation possibility, where when we donate bone marrow to someone from somebody else, that bone marrow can bring in T cell, B cell, and other immune cell, which can think of our body, the recipient's body, as a foreign thing and attack that body in which they are transplanted. That is a unique situation. But normally when somebody else's tissue arrives in our body, we wipe it out immediately and clear it. That is why the the blood transfusion reactions occur as well. So I just want to very quickly read out the four. So virus sticking in the cells, immune system unable to calm down, immune cell mutation, and autoantibodies. These are the four mechanisms, not two anymore. The two I was talking about two like a few months ago, but since then I've been studying more researches as well and looking at previous situations with the chronic diseases, and it looks like there are four mechanisms. Jamie, welcome. Angela says, Dr. Bean, what is COVID impact on heart, muscle, and heart function? My friend has high blood pressure and palpitations after COVID. What are some remedies to help counteract that? So, Angela, it really depends what was the level of the intensity of the COVID. It is possible the ACE2 receptors are present most abundantly in kidneys, then GIT, then cardiovascular system, then respiratory system, and then brain and other tissues. So of course, if the COVID has become spread enough that it goes in the blood vessels and connects with the ACE2 over there, or goes in the heart and connects with the ACE2 over there, then it can cause stress to these tissues as well. I had done this discussion in the past that the cardiac problem with the COVID is mostly because of the vascular issues. So when the blood vessel gets damaged, and the blood vessels lumens become narrow or dilated or abnormal, or the regulation of blood vessel is not normal, then heart has to keep adjusting according to the need of the body and the blood vessels misbehavior. And so it has to go up in its function or down in its function based on what blood vessels are doing. That is usually the problem. The second problem that heart can get is that heart's own blood supply can become compromised when the blood vessels are damaged. Third possibility is that when blood vessels are damaged and the blood is oozing out, I'm using a loose term here. Medical professionals would listen to this and say that is so wrong. What I'm talking about is the fluids that are leaking from the blood vessels, and that can reduce the blood pressure. That would also put pressure on the heart. So heart can have many pressures. Another fourth pressure on the heart is that when the lungs are damaged and we do not have enough oxygenation occurring in the lung, then the heart has to work more to circulate more blood from the lungs to cause more oxygenation or to get more blood volume oxygenated. So all of those put pressure on heart. Then, of course, there are psychological effects as well, that the COVID can cause abnormality of the brain's chemical substances, and it can cause lymphatic issues as well, which then cause mood swings and behavioral issues, which can also cause palpitations with that too. So, Angela, there can be many reasons that the heart could become involved. Now, what are the remedies? It would depend what is the problem. So the best way to do this is to go to their doctor and say that, hey, doctor, can you look at the CRPs and serum ferritin and the D dimers? So look at the blood's own state, look at the blood vessel state, look at the cardiac state. Based on that, you can either say, all right, we need to have some lymphatic massages, or we may need to have some blood thinners, or we simply need to improve our vitamin D and nutritional statuses, and we are okay. So maybe there is something with the lungs, and if that is the case, then you need to take, let's say, oxygen. So I have no idea what is your friend's actual state, so that I can't really, I can't pinpointedly say what is wrong to be fixed. Angela Zhang, thank you very much. Okay, so continuing. William, some claim flu is absent because of the masks and social distancing, but then why has rhinovirus infection remained steady? Some viruses are all but absent and some are unchanged and ineffurious. That's actually not really correct that the rhino is there. For example, I used to every year, I used to get this cold. This year I did not. Last year I did not. So I was just so, and it makes sense. If you are just away from everyone, you're not going to catch cold, right? Unless your own common cold viruses that are sitting within you, and when you become weak for some reason, then they take over and they start spreading. Or, for example, in the cold weather, our own viruses that are sitting in our throat can start replicating in the right temperature and start spreading. Somehow, we all know that, one, I think people kept their distances. Secondly, mask is important. I am a pro masker, so mask is important. Social distance is important. Continuing to use the sanitizers is important. People just generally stayed more clean and more aware. Their vitamins and nutrition, all of those factors, I think, came in together. And I was chuckling today when I read a news where it said that summer is coming and people are going to go out, and now we're going to have summer and pandemic acceleration. So news media cannot have their way. Otherwise, they just want the pandemic to accelerate in all cases so they can keep getting the eyes on their news media. They were saying that, well, in the cold, we are all going to be in trouble. That didn't happen. And now they're saying, well, the summer is coming, we're going to get out, and now we're going to be in trouble. I think that is also not going to be happening because we are more careful. Franz, thank you very much for the V to the super chat. John Scott has a question. Dr. Bean, medical lectures, adenosine deaminase deficiency results in pulmonary alveolar proteinosis, vasculitis, difficulty breathing, dry cough, headache. Do you agree? I'll have to look at the data. So if you have some link, I'm sorry for my hair today. they have grown. So John, if you have some link, can you please share that with me? Westfield says Dr. KK in India is recommending aspirin, beta blockers, and a statin before vaccination so that the inflammation doesn't cause MI in patients with cardiac issues. So again, that is a specific situation. Patients in cardiac issues, with cardiac issues, I don't know if the vaccine is actually going to cause inflammation or blood coagulation in them, but taking any precautions in someone with the pre-existing conditions may not be bad. I would just say here that these are, other than statin, these are pretty important things. That aspirin can cause blood thinning. Beta blockers are they're used very often, but still they have their side effects. So this should be done with a doctor's observation. Yes, Luffy has spoken. He just came in and spoke and went away. Jana says, tough question. What was the tough question, Jana? Westfield. Keep the questions tough. It keeps me on my toes as well. Sysmac Gallery says, question, is J&J vaccine has the lowest side effect of all vaccines? Not known yet, because as much as J&J has released their interim data, they have not released all the data. In the interim data, they said no adverse effects. So if you go with their reporting so far, they are saying no, actually I should back up. They're saying no serious adverse effects. But what are the mild adverse effects? For example, fever, myalgias, fatigue, we don't know yet. Sipal Steve says, have you heard about nanobodies for possible treatment? No, I have not. I need links to these things. M. St. Clair says, COVID is probably more contagious. Yes. So one of the reasons that it is spreading faster in some countries is the more contagiousness of the new variants. So Denise says that you said singular won't work. Yet, as you may or may not realize, it's a leukotriene blocker, which is directly involved with both asthma as well. So I am not discounting that this can help with the asthma-like or allergy-like reaction. The question is, would it help with the vaccines reaction? If it is allergic reaction, I have always maintained, talk with your doctor, tell them that I am allergic so they can give you the right thing. I don't want everyone to start taking Singulair before going to vaccination. But well, if it happens, then of course, leukotriene is part of the inflammatory pathways. And so leukotriene blocking is good to help with the inflammation. Miss Japan thought she was in bed with COVID. Oh, was they? Oh, I'm so sorry to hear that. Yes. So Steve says they'll release the full data sometime. So we'll go over that data, Steve. John Scott says, Dr. Bean Medical Lectures, have emailed Melissa and support and tried Twitter, messaging turned off. I have no idea. So this is not this is not an intentional thing to turn off the messaging. I do receive messages. I don't know. Maybe one has to be a follower to send a message, or if there is a setting, please tell me. I'll go change that setting. It's not intentional. And I will ask Melissa about the message. Oh, Japan is here. I understand about the mouse. My kitten lotus messed up my YouTube format, so now I primarily text questions and comment from my little phone. And Japan, how are you doing? You doing okay? So, Sher, this is a very good question. Did you hear about a man that had COVID and he shed virus for 5 months and it mutated several times in his body. So it's actually very, very much possible. Let's think about it. How is that possible? When we get virus in our body, even when we are on the normal pathway of recovery, the virus is going to mutate in us. This is a natural, normal behavior of this virus and many viruses, that when they are making their millions of copies, think about it this way, that one cell, if I make one cell over here, one cell has up to 10 million ribosomes in it. Ribosomes are, imagine they are part of the virus replicating machinery of our cell. 10 million ribosomes per one cell. And we have millions and millions of cells at viruses' disposal. Imagine how many copies it is making every few hours. And then not all copies are going to come out exactly like their ancestor. So there are so many mutations that are occurring even in one person who is infected. Now, someone who may not respond to the virus correctly, or may be immunosuppressed artificially, or maybe because of a disease, they may have the virus lingering in them for a longer period of time. And the longer the virus is going to stay in them, the longer it would continue to mutate. Imagine every new baby that is born has a different face. Similarly, every new virus that is formed has some tiny mutation somewhere. Although its proofreader tries to correct it, but still there are going to be mutations. So every one of us who will get infected will have mutations in them. Most of those mutations are wasted away because that virus is not competent, it's not viable. Some of them would have a chance to get out. Others are just going to get cured by our immune system. So if somebody has immunosuppression or has a carrier-like state, then the virus can sit in them and continue to mutate for a long time. Good question, Cher. So Japan says, Barbara Warren, everyone has some trouble. Machiavelli says, yes, proofreader failed, didn't it? So proofreader does fail, although the failure rate of proofreader for SARS-CoV-2 is much less than other. There are other viruses who don't even have a proofreader. They mutate even more. Jim says, I haven't had a cold since start high dose vitamin D3 in December of 2017. That's also when I was discovered to have NHF cancer. So sorry about that. But vitamin D is actually an important aspect. Vitamin D definitely has an important role. So Jenna says, what labs to see if it is mutated in body? No labs. They will have to pick up the B cells, for example, and then extract the viral RNA and then look at the sequence of that viral, and then just like the next strain. So there are labs where they can do sequencing, but these are not regular labs. So Hari says, is it okay to take ivermectin along with remdesivir? Yes. So remdesivir has a very different function. Remdesivir's function is to, when the new viruses are formed, it kind of becomes fake material, raw material for the virus. So when the virus is formed, it just crumbles and dies very fast. But on the other hand, ivermectin reduces the virus's function, virus's behavior, virus's messaging. So it kind of is virostatic. So there are two different things can be taken together, yes. So Dr. Vasara says, if I make millions of copies and several mutations jump, then a vaccinated person will kill the original spike viruses. So that is what happens, Dr. Vasara, generally, even when the copies are being made, as long as the spike protein kind of things are intact, our immune system is going to find a way to kill it. It is when the spike protein, for example, has changed so much, or the external surface has changed so much that the immune system cannot recognize it. Then the question for the virus is that can it change so much that we do not recognize it, but it can still be functional? Imagine if I am born without my hands, so I cannot do the hands function now. So if the virus is born without the spike proteins, then how would it function? So there has to be a balance in its mutational change and then the type of change. So Nancy says, in your expert opinion, how long should one wear a mask after the second dose of COVID vaccine? So Nancy, various companies have given various days after the second dose. For example, in case of Pfizer, they say 7 days after the second dose. In case of Moderna, actually Pfizer, 10 to 14 days after the second dose, and Moderna says 7 days after the second dose. So every vaccine company has a set number of days after the second dose. And so you have to hear that out to say, okay, which vaccine did I get? And what is the number of days after the second dose that I should be okay? So 1x2 says, I've been taking vitamin D for a year, but just got one cold. So yes, I am glad as well that Japan is here. Japan, I hope everything is okay. I'm getting concerned that it seems like there is something. Okay, so should I? Yeah, so I am actually quite happy. I just saw this Williams comment here. Deaths are down too. So yes, the cases are coming down, the deaths are coming down. In Israel, it is interesting that after 30 to 40% of the population vaccinated, the cases are still not coming down that fast. And they are saying that it is because of the variants. So if I go here, Worldometer Israel, or Israel. So here, if you look at the new cases, they are definitely down. So if I say 3 years average, these are down, or 3 days, 7 days, they are definitely down, but not as down as 30-40% of immunized community should have. And look at the active cases, they're kind of hovering over the same number as before. And so they are saying it is because the new cases have become accelerated because of the new variants. However, here is something that makes me a little bit comfortable, and that is that death rate is definitely going down. So if I say here 7 days, it is coming down, although it has become sustained as well. So if Israel is an example of how a vaccinated community will look like, I am puzzled at this, that the cases are not really going down the way they should with this much vaccination. I was expecting that to come down. So we'll wait for some more. So let's say 30-40% of the community is vaccinated. Let's see what happens. Mark is saying, where is Luffy? Luffy was here and then he ran up. I can hear him meowing. Wow, very interesting. So William says that we are discussing South Africa cases down, deaths down, yet no vaccine, no ivermectin. So let's see that. And I have a theory. So Worldometer South Africa. If I go to South Africa and oh wow, look at this. Look at this. This looks like a vaccinated community. That is way down. If I say 7 days average, look at that. That is what I was expecting with Israel. And look at this, deaths are down as well. So can it be that the more contagious virus is less lethal? But here is the thing, if it was more contagious, then it would be spreading more. Maybe it is spreading more with less symptoms. So they actually do not know that it is doing it. Interesting. I love this one. Thank you, William. I did not know that, Steve. Maybe. So let's do this. Patricia Hockey says, have you talked about SSRI yet? You were going to. So I talked about it briefly last time, but because Twitter messages were still left over, so I am still here doing the Q&A. And after this, I'm going to talk about fluvoxamine and SSRIs. William says, what is your theory on virus interference theories? No flu, no norovirus, even in the countries with no social distancing. I'll have to form a theory. My theory is not going to work. So I'll pass for now. My theory for South Africa is that it is possible that, as I had been saying in the beginning, that as the virus becomes more contagious, more spready, it will have to become less lethal. So maybe it is not even causing enough symptoms, and it is just zipping through the community and creating immunity in them without symptoms, and then we would have no more cases because people are not going to hospital, and of course no more deaths. That is expected of a virus that has become more rapid in spread, and then it would have to become less lethal. So that is my theory for this one, for South Africa. So B12 says, oh, also South allowed ivermectin. Ivermectin would have an effect for sure. Jana says, agree to Dr. Bean. Thank you. So should we look at some of the, Mr. J says, question, India has a lot of cases like UK and Brazil. Should we expect a variant to emerge there soon? I am sure that they have variants. How is the India's situation in terms of, if I go to India, wow, second top, 10 million cases, total cases are steadying out, daily new cases, look at this. I do not know if the data is reported correctly, but if this is, let's take it on its face value, say it is correct, then look, there is a huge decline. And look at this, active cases are declining, total deaths are becoming steadier. Look at this. So either it is a reporting issue, or the ivermectins and maybe the virus is just going through the community and creating herd immunity. Yeah, just look at it. It is a lot. It is declined a lot. So again, either a problem with the reporting, or if it is really declined this way, then this is awesome. Okay, so let's look at some of the Twitter questions as well before Twitter friends, Cool Beans, boycott me. So CB3690, can hydroxychloroquine 2 times per week and ivermectin every 2 weeks both be taken at the same time for prophylaxis? So again, without being specific, hydroxychloroquine can be taken that way and ivermectin, and they can be taken together. But please remember QT interval issues and the contraindication with the ivermectin. So talk with your doctor about that make sure that the cardiac situation is correct, make sure that the blood-brain barrier is okay, and then yes, combining them is not a problem, but taking them in the first place should be done with some doctor's observation. Baxter B. Bear says, here's a description of the saponins. So here in the Novavax, and I have this link here as well, Novavax has an adjuvant in their vaccine called Matrix M. Matrix M is a surfactant-like adjuvant. And what is a surfactant? It's like soap. So it is present in our alveoli as well. So what happens is that we have chemical substances that can cause the water layers to be broken up, just like soap can break up the lipid and other layers. And that allows the water to kind of stay spread, and that keeps our alveoli open. That is a function in our alveoli, surfactant. Similarly, Novavax has a surfactant-like thing called saponin. Saponin is a soap-like structure. Molecules, if you see here, Novavax CoV 2373 consists of a stable perfusion protein antigen made using its proprietary nanoparticle technology and includes proprietary Matrix M adjuvant. And this is the discussion of what that adjuvant is and what is the benefit of it. So here is a little article, and again, people say don't believe Wikipedia understood. There is a study here, number 6, that shows that this saponins can be dangerous as well. And the dangerous part of them is, so let's look at what is the basic function. The function is that when saponins are present in the, let's say this is the Novavax vaccine particle, and this particle has saponin attached with it. Saponin cause T helper 1 and T helper 2, both cells, it irritates them. It is toxic and it is irritant. When it irritates these cells become angry and they release more cytokines, plus they become more memory cells. So it enhances their activity, both T helper 1 and 2. That is the function of saponin present in the Novavax vaccine. However, it is known to be toxic as well. So now if we look at the question here, Dr. Sayed, thank you so much for your work. I'm joining you in the process, so you might have addressed this issue. Could you please compare the risk and potential toxicity from the COVID vaccine adjuvants like the saponins in the Novavax might be a good show topic. So Baxter, definitely, and saponins are part of the Novavax vaccines. Novavax had not had a vaccine that was out in production successfully. This is their first vaccine that would come out and be successful. We will see what happens. There is a concern with the saponins that these can be toxic, but I'm hoping once again that the amount, the dose will be so low that the toxicity will be negligible. And it's just a little irritation for the immune system to get up and get ready. And so if you wanted to read more, please do this. Here they've talked about what are the benefits of saponins. Here we've talked about, or the people who wrote this article, that it is used. Here is what the saponin is. Zubair says, any information about Chinese Sinopharm? So Zubair, that is still a topic that I need to do. Joe Lind says, is it true that RNA viruses like corona, influenza, and common cold all require RdRp in order to replicate, regardless of how much the RNA virus mutates? If so, what can people at home take that can neutralize or block RdRp and stop replication? So yes, most of the RNA viruses have RNA-dependent RNA polymerase. The reason for that is very simple. When the RNA virus arrives in our body, it brings in RNA. That RNA now need to be translated to make proteins of the virus that are virus's machinery to make more viruses. At the same time, we need to have this brain of the virus. Copies of that are also needed so that when this machine is going to make new viruses, then this brain will be inserted here, and that is how a complete virus will be formed. The problem is that when we make a copy of the RNA, the copy is mirror image. So it is the inverse of it. So we have to then make a copy of the copy to make it back correctly. It is just like if you stand in front of a mirror, you are flipped horizontally, correct? And then if you want to correct it, you have to stand in front of the mirror again, or that mirror has to be reflected again and you will be corrected. Same thing here, that RNA needs to be replicated twice. This function is done by RNA-dependent RNA polymerase enzyme. So all RNA viruses will need this enzyme. This enzyme is structurally slightly different. It functions the same, but it is slightly different in every virus. But yes, because it is present, we have drugs that target this. Then we have zinc that can target it. So if at home, people can take zinc with quercetin, or zinc with hydroxychloroquine, or zinc with onions, or zinc with any vegetable or fruit that has red skin, that would help, because zinc is an RdRp blocker. Ivermectin is an RdRp blocker. So these are the kind of things that can be taken at home. Good question. Kamran Jamil, so talking about the antibody tests. So Kamran, I think you were present and you actually made a comment about it as well. We talked about antibody and its test and its titration and levels and the possibility of variations. Nico Demo says, follow-up question on dysbiosis. So I think this is the question. Kyler Falcon says, what do you think about this technology? Actually, there is another question about microbiota. So the gut microbiota, I have to do some more research, because I'm seeing a lot of news and articles that say that somehow gut microbiota is important for COVID immunity. And I want to understand that what is there. So your question is in a similar direction. I need to look at it. The study that I have seen says that when the COVID sticks out in the gut cells for a longer period of time, it actually helps our immune system become more efficient because of the somatic hypermutation and affinity maturation, and that actually causes our body to fight it better. It should not make us long haulers. So exactly how this could be disrupted and a person become long hauler, I have to see. I didn't see any research so far. So I'll do that research. This one, Kyler Falcon says, what do you think about this technology? So here is the technology. Interesting technology, but this is the company that is that has this technology. Here is what they're saying. In a controlled lab environment, precise wavelength of light. So they didn't tell the wavelength because it is a company that they are trying to sell their product. So the precise wavelength of light achieved greater than 99.9% reduction in MERS-CoV viral load at doses of energy that have previously been proven safe to human tissue. So what they're saying is that we know a dose of light that is safe for humans, but can disrupt 99.9% of the virus. It is going to be a very interesting thing to see, because I find it hard to believe that there can be a wavelength of light that would not affect our cell, skin cell, but still affect the virus particle. And so how would that happen? I want to see that. But this is what this company is saying. I went through their whole topic here. They haven't talked about exactly what it is. Sander says, could you take a dive into CureVac? So Sander, I took the note about this vaccine. They are the third RNA vaccine, but they are supposed to be lower dosed. What kind of impact would that have? So I took note. I went over that once, and I think I'm not ready to talk about CureVac right away, but I'll talk about it. So let's go to the live site for a second. Rima says, sounds like a Mr. Pillow story. It may be possible. Jenna says, I'm praying Ivermectin helps my heart. Praying for you, Jenna. Patty says, hi, doc. Should I take Ivermectin to prevent COVID-19 or wait until I get it and then take Ivermectin? So no specific advice. I can't do that. I cannot. For my patients, patients who do not have COVID, I have always put them on ivermectin prophylaxis. So I prefer prophylaxis, but cool beans here know me that I'm a little bit of a chicken for my patients, that I don't take risk with them. So I have put them on prophylaxis, and so I don't wait for the infection to occur. When infection does occur, I am very aggressive there as well, but I keep the prophylaxis. So thank you very much, Richard. Okay, so William says, Dr. Bean, look at the cases on Worldometer for the entire world. You'll see that the entire planet cases are plummeting. Has COVID mutated itself out of existence? I would definitely love to do that. So let's say world coronavirus cases, 107 million cases, 2.3 million deaths. And let's see, daily new cases and daily new deaths. Wow. So if you look at it, yes, you're correct. Daily new cases are going down. Of course. So I don't want to toot my own horn, but remember, I kept saying that if it would mutate to spread more, then it will become less lethal. And let's say if it becomes more spready, then the only way for it to continue to spread more is that if people don't get symptoms, they got it, they don't even know that they got it, and it's just like common cold, and they're walking about and they are not worried, and that is how they'll keep giving it to others. If that is the case, they're not going to go to hospital. And if oxygen saturations are not dropping, if they're not becoming fatigued, so then society would just stay open. So you may be, William, very much on the right track here, that maybe the virus itself, and in the beginning I kept saying this as well, that virus's job is to adapt to us. It is trying to live with us. And I had made a cartoon which some folks commented and they said, why did you do it? I made the cartoon where the coronavirus had a placard with the heart drawn on it, that I love you. And that is what I had meant by that, was that it is trying to adapt to us. And so if it continues to adapt, it's going to become harmless for us. That is the only way it would survive. Otherwise, we will come back hitting it hard. Yes, it is causing lots of damage, but we will also cause damage to it, and eventually it will have to go away. So the better thing for this virus is to adapt and live peacefully. Okay, so Luffy's here. So Cher is talking about, in the US, our health gurus are wanting to possibly push second dose 90 days based on immune system and vaccine history. Would you be okay with that? Depends which vaccine. And look, the thing is this, because we have not trialed the vaccines with a larger second dose window, in theory, we should not be okay with it, because that's not how it was tested. If it is tested that way, then we should be okay. The problem I have with testing now is that we are seeing that people can get infected and they can even die. So why to put them at risk? Give them 2 doses and be done. And why can't you get 2 doses? Still, I am okay with this, that if we cannot get 2 doses, then at least keep spreading it out to as much of the community with 1 dose as possible. So get more protection than what we have now. Chuck says Luffy's voice lessons are paying off. Yes, he's becoming more and more of a articulate Um, yeah, he's gonna come and get me. Okay, so I had read a comment here which just scrolled up and I can't find it. That was about me anthropomorphing the virus, and there was something about it. I just cannot find it anymore. Okay, I'm gonna continue to go over the Twitter as well. So this is Sander. Then Joe Smith says, regarding pregnant women in 20s and 30s, are they high risk? And if so, what prophylaxis to use? Since ivermectin harms fetus, many deaths post vaccine. How can we rule out the danger of ADE from the vaccines? Anything to do for dizziness when taking ivermectin? So most importantly, I did this talk before as well. Dizziness with ivermectin is a bad sign. That means that ivermectin is crossing the blood-brain barrier and causing central effects. So stop ivermectin if that is happening. That's one. And secondly, excuse me, give me 1 minute. Luffy wants to probably go to the next room. Hey, Luffy. So, so number one, stop ivermectin if there are central symptoms. And secondly, the ADE's danger, it is a theoretical danger. It is always going to be there, but it is not seen with ivermectin. And thirdly, the pregnant women, that is an area all cool beans know that I am very careful about because I'm not specialist in that area. And that is the most sensitive specialization of a pregnant woman and her child. So I am very, very concerned about talking for that area. Best is to talk with the doctor. I feel bad passing on this one, but please realize that it is a very sensitive thing. Thunder Meadow says, thank you for all that you do, Dr. Sayed. Your lectures are both life-saving and fascinating. I'll be long-term follower beyond COVID. Thank you. Question, is ivermectin an effective treatment for South African and Brazilian variants? Yes. So once again, let me qualify my yes. Ivermectin is not a treatment for COVID. It is a drug that reduces the COVID itself. And by treatment, what I mean is it is not virucidal. It does not kill the virus, but it reduces the replication of the virus in our body sufficiently that immune system gets a chance to attack the virus and kill it. And our cells get a chance to defend themselves from the virus. That is the behavior of ivermectin. So any variant of the virus, ivermectin can manage it. And here is how. Let's look at it. This is a cell, any variant. Let's say, and by any variant, I'm talking about a variant that is still working with ACE2 receptor. So first thing, ivermectin man stands here between the ACE2 and the SARS-CoV-2 spike protein. So that is first. Now it doesn't matter what variant it is. It can be UK or Brazil or South Africa or original Wuhan variant. Ivermectin will stand here in the middle of these two and reduce the viral entry into the cell. So that is one way it would help. Second is, once the virus is fused with our cell membrane and the RNA is in the cell, then the virus is going to make RdRp enzyme, and ivermectin can stall this enzyme. So this is the second one. And again, it doesn't matter which variant it is, all variants will need to make RdRp. So that is Luffy running around. So that is ivermectin's function. And sure, it will continue to work. So that is true. Thirdly, this RNA is going to make a polyprotein. In that polyprotein, there is another protein called 3-chymotrypsin like protease, this protein is also stalled or reduced in its effect by ivermectin. That is a third function. And again, it doesn't matter what variant it is, because they all have RdRp and they all have three chymotrypsin-like proteases. So totally good for all variants. Fourth is that when the virus is sitting here and making its proteins, these proteins want to go into the cell and in the nucleus and cause the reduction in interferon production and tumor necrosis production and tumor necrosis factor production and nitric oxide production. And for that, they use important alpha and beta, which are proteins in our cells. And these are the ones that are used by the viral cargo to go into the nucleus. And fourth function is that ivermectin occupies them, and so viral cargo cannot get into the cell. It doesn't matter which variant it is. They all do this. And because of that, ivermectin is pretty neutral about them. So it is an equal opportunity blocker for all of these variants. And then finally, ivermectin has another anti-inflammatory-like behavior, and that is that it can suppress the NF-κ beta pathway, which is for cytokine production. So it can suppress that pathway as well. And again, whichever variant it is. Because of that, ivermectin is pretty universal in its reaction to this virus. Mirror 91 says, does ivermectin works better in pre-exposure prophylaxis than in the post-exposure one? So first of all, the concept of prophylaxis is always pre-exposure, correct? Now, in my opinion, prophylaxis is correctly done if it is done before the infection. So ivermectin taken before the infection is important. Now the question is, do we know that long-term usage of ivermectin, what kind of side effects will we have? We don't know them clearly. So before infection is right. It is useful for all stages of infection as well. And it is useful after the infection too, for example, in long haulers. The question of prophylaxis or prevention after the infection with ivermectin, I feel, is not necessary, because once you have the infection and you are able to fight with that virus with your immune system, why do you need ivermectin to block that virus anymore? If it comes in, your immune system is going to respond to it again and take care of it. But if it makes you feel better, you can probably take ivermectin, but maybe in a low dose and less often. Susan is saying that Luffy is calling his dad. Yes, Luffy is a riot. Tanzo Kang says zinc picolinate, zinc gluconate, zinc glycinate. Which one is liposomal? So Tanzo, there are actually separate. If you Google liposomal zinc, you would see that they are available. However, I want to make sure that one thing is clear, that if we have zinc which is liposomal, this does not guarantee that zinc would not need zinc ionophore, for example, quercetin or hydroxychloroquine. The reason for that is when we eat zinc, when we take zinc by mouth, orally, and it is liposomal, that means it is in a lipid particle, then that lipid particle will be removed when the zinc is going to be, so let's say this is the GIT. This is the lumen of the GIT. And in here, the zinc is going to be absorbed from the GIT cells and then get into our blood. This lipid on it will actually allow the zinc to fuse here better and then get into our cell, into our blood better. So that is the bioavailability. But this lipid will be removed from zinc when it has appeared in our blood. Now the zinc's next function is to come out of the blood and go into the cells, and now it would need ionophores. So liposomal zinc does not mean that it has an ionophore already. Its ionophore was already removed at the gut level, and it would need another ionophore later on to be going into the cells, and that would be quercetin or hydroxy or EGCG and so on. Josme says, senior death risk from vaccine. Can you calculate the correct risk numbers? It's not the number of dead following vaccination divided by all those vaccinated, including all the young medical workers. Must use the total of senior vaccinated as the divisor. I agree with you. So this is the same thing that I protest when somebody comes up and says the total number of deaths with COVID divided by the whole world's population, so it is nothing. And I say that's not really the right way to look at it. Similarly, you are saying that the number of deaths in the elderly should be divided by the vaccinated in the elderly, and that is a correct way to look at it. Medical cannabis, Emily, I'll do a separate talk about that. Julian, should ivermectin be given with selenium and vitamin E to reduce the risk of testicular dysfunction and renal and hepatic toxicity? So it is a very interesting topic that you brought up, Julian. So let's look at it. Here. So this is an article which is based on this study. In this study, if you see here, this is April 2020. In this study, they said we used ivermectin in rats, and what they found was that the testicular cells started dying with the continuous use of ivermectin. And what they did was they supplemented vitamin A, E, and selenium, and they saw that those rats that were given with ivermectin, vitamin E, and selenium, their testicular cells did not die, so their testicular function stayed intact. So the question here is that would you recommend that people take selenium and vitamin E? Of course. And I was not aware of this side effect. So this is a study from April 2020. I need to actually look more deeper into other studies that show this, but they have said ivermectin, especially ivermectin, should be given according to the dose recommended by the manufacturer, and repeated dose should be given with vitamin E and selenium. Fortunately, I have always tried that we do not go above the therapeutic doses, but the frequency is more. So they are saying that combine it with vitamin E and selenium. So that is a very, very important point. And please remember, everyone, vitamin E and selenium, especially the men who are taking ivermectin. So Julian, thank you very much for bringing it up. Anna Marie Inman says, given that we know immunity lasts 8 months and then starts to wane. So Anna, that is not exactly correct. It's just that we haven't lived with the virus long enough to be able to say that 2 years later or 3 years later we are still immune. Because we have lived with it for a shorter period of time, we only know for a shorter period of time that we become immune when we become infected. So, but let's look at the question. Given that we know immunity lasts 8 months and then starts to wane, it makes one rethink long haulers who are past or nearing 8 months post-infection. Long haulers will need vaccinated after 8 months? Question mark. So Anna, once again, the studies say that up till 8 months, we are sure that immunity stays. But they do not say that after this, it declines. They just simply say we haven't yet tested after. So I'm sure that they are testing at this time as well, and they'll come back and they'll say, okay, we have knowledge now that for 12 months the immunity stays or not, we'll see. When we look at SARS-CoV-1, that immunity stayed for 2 years full, and then it started declining in the 3rd year. So for 3 years, there was immunity. So because the basic core concept for the question that immunity would start waning is not yet known, I don't think that the vaccine is needed. Having said that, all vaccine companies and all NIH and CDCs are saying long hauler or somebody who's infected before, please take the vaccine again. So I would not say don't take it, but I feel that sometimes it is not necessary. In long haulers where the virus may be still sticking somewhere, Maybe giving a vaccine will irritate the immune system enough to cause it to go and attack the virus. I would think that the virus itself should be enough of an irritation to make immune system react, but maybe it might help. Joe Smith, Dr. Bean, you hit it out of the park. Thank you for rebutting Kahil video, which will help people to reject the fear mongering. Thank you very much. Jumping Bean, any updates on what to use for nasal rinse? The nasal pharynx is the primary entry point, and many of us are defenseless without vaccine or ivermectin for at least 3 months. I've been using the baby shampoo, but there must be more. So, Jumping Bean, number one, welcome back after a long time. I had done this talk, mouth washes that inactivate coronavirus. So please see some of these that were used in various studies. Joe Smith, pregnancy prophylaxis. I'll have to do some more thinking about talking about pregnancy. Dallas for Life says, question, I know you touched on this yesterday, but can therapeutic vitamin D level help modulate a patient's inflammatory response from the vaccine, resulting in less side effects? So short answer, no. Vitamin D's function is to keep our immune system optimal. That means immune system is going to react the way it is supposed to react, in which case there might be side effects in some people. So vitamin D is not going to reduce the side effect. It is also not going to let the side effects become runaway. So it would just keep the optimal results, and optimal response will occur. Scott Robinson, and an optimal response may be different in different people. Some people are allergic, so their optimal response is allergic reaction. And some people are not allergic, and some people don't even get pain. Scott Robinson says, is there new convincing data on asymptomatic spread of the virus? Yes. So here is a study. This study is posted on January 7, 2021. So pretty recent. In this study, they are saying, and check this out, this is actually beautiful. In this base case, in this study, 59% of all transmission came from asymptomatic transmission. This may be the world's, overall cases are plummeting and the cases are going down in South Africa as well. 59% of all transmissions came from asymptomatic transmission, comprising 35% from pre-symptomatic individuals, 24% who never developed any symptoms. And I hope we know this, that let's say, or let's make it this way. Let's say this is day 0 when somebody gets the virus. Normally, it takes anywhere from 2 to 14 days for the symptoms to develop. Mean is 5.1 days. And the time before that time of symptom development is called pre-symptomatic. And we have discussed a study with Cool Beans in the past that 2 days before symptoms, people do become contagious and they start shedding. There is enough virus quantity built up that they still don't have the symptoms, but they are shedding. So this is where they can shed. And that was the 35% of the cases. And then there are people who would actually never have a symptom, even when they have the disease that occurs and becomes corrected. And there is 24% who are here. So a total of 59% of the infections are transmitted by asymptomatic folks. So again, the rest of the part, you can take it as political or not. I feel it's sad that this is political, that somebody would say, well, you are saying this because you want people to do social distancing and masks. But that is the point, that even those who are asymptomatic should wear a mask, because we never know if we got it or not. But this is the study which is pretty recent. Scott Robinson, the reaction we are seeing on social media, are we seeing a kind of Herxheimer reaction where patients with primed immune system are going haywire with massive histamine release? So, and would Benadryl and Pepcid and Zyrtec help. So let's look at it. What Scott is talking about is in case of worms, especially with ivermectin, what happens is, imagine we have a big worm. So let's say this is a worm, and this worm lives in us somewhere. And he is a pretty happy worm and he's having fun. And we take ivermectin, and ivermectin goes and paralyzes the muscles of this worm, and the worm dies. Now, when the worm is going to die, it is also going to be attacked by our immune system, and they are going to destroy it. When the worm is destroyed, and this happens with the chronic diseases like Lyme as well, that some people who have chronic Lyme, when they start their antibiotic therapy and the Lyme pathogen starts breaking down, or this worm starts breaking down, these broken pieces can start acting as an irritant for the immune system. An immune system within 2 hours goes totally nuts and mad, and it overreacts. This is not an allergic reaction. This goes away. It is self-limiting. It goes away by itself within a few hours. But this is actually immune system's response to a massive flood of broken pieces of the worm or the pathogens. This is called Hershmeyer reaction. Of course, any anti-inflammatory serum drug will help with that. So now the question here is from Scott, that the reactions that we are seeing in people because of the vaccine, is the vaccine causing the virus to be broken down? If I translate into Hershmeyer's mechanism, is that happening? And the answer is no, that is not happening. Vaccine is not triggering the immune system to break the virus. Vaccine is triggering the immune system, in some cases the mast cells, to overreact and release histamines. So eventually there is histamine released, whatever is the mechanism. So then if you say that, hey, are these drugs going to help? Benadryl, Pepcid, Zyrtec, or other antihistamines? Yes, they're going to help. So yes, these are helpful. Mechanism is slightly different. So last 2 tweets, and then I'm going to come over to the live side. I very disciplined way, just kept going on the Twitter side. Dallas for life. Question: although UK variant caused huge spike in infection rates in England, how do we know that same variant hasn't been in the US for a while? Ideally, we should do genomic testing and then know. And if we are not doing it, then we would not know. It's possible that it was here for a while. Avox Coffee Bean, is there or will there be any test to see if a person has acquired an immunity and to what degree from having taken a vaccine? Ideally, antibody test or then cytotoxic T cell markers can be used. But in the US, you cannot get an antibody test without a doctor's prescription, which is sad. Ideally, when we are given a vaccine, after a few weeks, the right number of days, we should be allowed to go get our antibody test done just to see have we become protected or not. Okay, so this is done. Twitter is finally done. How are things here on this side? Jana says, question: what probiotic is best for IBS from COVID? Jana, I have to do the research on probiotics. So without that, if I speak, it would be incorrect. I have read a few articles so far that they are thinking that some fecal transplant can help bring in some probiotics that may be necessary, but I have to do some more researching before I talk about it. So please give me some days. Machiavelli says, I thought you can buy a test. You can buy a test, but doctor has to prescribe it. Rima says, would a flow assay IgG test work? Yes. As long as you can get the test, let's say even in the US, if you can get it, good. Then after, let's say Pfizer says, well, 10 days after the second dose, get yourself tested then. Mr. J says, what is the absolute worst case scenario that could happen with this virus? People die. That is the worst case. I actually think that long hauling is not something that is Can you imagine that this morning when I was reading up about long hauling, I'm preparing myself to talk about long haulers more for this week. I was struck with so much depression that if this long hauling state becomes permanent for people, imagine the number of people that are going to suffer for the rest of their life. And that shakes me to my core. It shakes me to my core for two reasons. One, the feeling that people are going to be in that misery for a long time. And secondly, the knowledge that we can attack this infection early on. We can do prophylaxis, we can do early treatments to prevent long hauling, and we are not doing it. So that this morning I became scared of this. So I'm going to talk more about long hauling. But Mr. J, both of them, for living, the long hauling is the worst case, and the other is, of course, people die as well. Kathleen says that, do you have any advice about taking a vaccine if the person already have an autoimmune disease? So they have actually trialed it on the folks with the autoimmune disorders as well. As long as you do not have severe allergic reactions, autoimmunity itself is not a problem. So what they need to know is, when you go to them, is that what is your history of allergies and autoimmunity? That is correct, Stephen. Roundabout way. So Stephen Westman says many blood donation centers do an antibody test. Roundabout way for some to check. Yes, absolutely correct. Machiavelli says, I still think it's from the damage done to organs. Machiavelli, it is entirely possible that the damage done to our organs cause long haul things. But in that case, there has to be the intensity of disease that matches the damage. For example, people ending up in hospital may end up with the lung damage or cardiac damage. That is understandable. Or people ending up on ventilators and then recovering, and then their lungs and their heart or their kidneys have damage. That is understandable. But those who developed milder symptoms, stayed home, and then became long haulers, that is where it is not the organ damage. It is something more. Maybe it is just the organ damage. That is also a theory. So William Goff says that, how can I get Dr. Mello and you two together to speak on colchicine? Two ways. Either send an email to support@drbeen.com. Melissa is our support lead. She can talk with me, or just tweet at me and connect us on Twitter, and we can talk. So Al says that we need early treatment for COVID. It's ridiculous that docs aren't trying harder. Yes. When I was a medical student, in our college, forensics was a subject as well. I believe forensic medicine is not part of all colleges' curriculum. And I forgot the poison's name, but we studied a poison in which what it does is it causes the muscles to contract. And so that causes the person to eventually not be able to breathe, and the person dies. But meanwhile, their brain is fully active. So they are actually aware that I am dying and I'm not able to breathe. And imagine the claustrophobia that person would feel. Sometimes when I see this situation with COVID, I feel that claustrophobia, that we know that we can do right. We know we can use ivermectins and vitamins, and we can make vitamin testing public. We can make ivermectin public. We can ask people to come to a stall and say, okay, what is your history? And there are young doctors sitting there and deciding ivermectin or not, hydroxy or not, zinc or not. We can create those, imagine the whole country, whole world has been stuck in this thing for a year. Spare a month and put up those stalls everywhere. That's going to be less expensive and less time from people. And more people can be saved that way than what we are doing at this time. So to me, it seems like that poison that has a brain fully alert, we know what is happening to us, and we know what is the right thing to do, and we still cannot do it. I think it is strychnine. I forgot the name of it. I was not very fond of the forensic medicine, maybe. That's correct. Jenna, we will figure out the solutions. Don't be scared. But this is just me becoming, so I go through the whole emotional tour with my patients, with the situation. And so this is just part of that. I didn't mean to scare you. Okay, so Gold Country Raj says, Dr. Bean, please look at right sleep. It will be worth your time. So let me write it down. 1 second. Cool. Jenna, what are your vitamin D levels and what are your general nutritional levels? Sepple Steve says, Dr. FYI, nanobodies are small protein molecules, no need to refrigerate, can be inhaled and attached to the viral spike protein, not allowing attachment to the ACE2 receptor, also easy to produce. I love it. I would love to read up more about them. That would be awesome. Richard says, we feel your pain. And really, it is a pain. The whole humanity is stuck in it. I become very frustrated. You don't know, throughout the day when I'm studying and preparing and I'm thinking, I go through all of these emotions that we can fix it. We can save people from getting into long hauling state or dying. And we still, today, for example, I just became so mad at the folks who stopped hydroxychloroquine after talking with Dr. Vasaras. And I just, it was, Debbie Boss says, why is there no curiosity or research on the wavy pattern of symptoms of COVID-19 disease? No matter length of the recovery, this pattern is prominently reported, but no discussion. Debbie, just generally, doctors are not looking into these things very carefully, very methodically. It almost seems like doctors need to go back to, for this disease, go back to medical college and relearn this disease. They have to study that way. That's what I'm doing. I was calculating a few days ago, almost a year now that we've been discussing, about 300 videos now, including these question answers. And in almost every video, there are 10 to 15 articles or studies that I study. So imagine this, 300 multiplied with 10, I have at least studied 3,000 studies and extracted information from there and shared and discussed. This is what doctors had to do because this was something new. So I'm with you that, yeah, it is not happening. John Elderton says, Bruce Patterson said that 25% of long haulers have low CD8 percentage, and we are finding viral protein in long-lived macrophages. No evidence of viral replication. That is the tweet. So no evidence of viral replication means that virus debris is sitting somewhere. Sitting in the macrophage means that macrophage's job is to clean up the virus debris. So you are going to find virus RNA and pieces in macrophages because they are the cleaning crew of our body. Now, 25% of long haulers have low CD8 percentage. That is interesting, that they have low cytotoxic levels. I have always felt that the cytotoxic pathway is much better pathway than the T helper 1 pathway. The question here is, do they just generally have low cytotoxic cells, or they have low cytotoxic cells reacting to SARS-CoV-2. So I think I need to call Dr. Patterson and maybe invite him once more. Okay, so Jane says that exosome CD24 Israel can be inhaled as a nanobody particle. Interesting. Debbie says, thanks, but what's the reason for wavy pattern of symptoms? It's very distinct. No other virus behaves this way. So, Debbie, of course, I cannot, without really knowing what is happening inside a long hauler's system, here is what I can postulate with you. And so, forgive me if it is wrong. This is just like I had that ADE theory. This would just be a theory. So, check this out. What happens is, let's say this is a macrophage, and this macrophage has ingested a pathogen. Macrophage is going to activate naive T cell. Naive T cell is then going to activate T helper 2 or T helper 1. We know this path very well. And then either we'll have plasma cells here that will make antibodies, or cytotoxic T cells here doing the killing. In this whole process, normally T helper 17 and T regulatory cell need to be activated as well. These guys' job is that after a few days to stop this mechanism. They would have to bounce back and say, guys, just stop working. You're done. Stop. Now imagine that these guys become active, they stop the immune system, and the immune system stops. And then these guys go away. They stop the whole thing, and then they retire. They are dead. They are killed. They are eaten up by macrophages. When that happens, and imagine if the virus is still sitting somewhere, or immune system has become dysregulated, or macrophages have become mad because they have some pieces of virus sitting in them, now they're going to start activating again. And then the whole process starts again. These guys are activated once more. They are going to come back and say after a few days that, hey guys, stop, stop, stop. And the immune system is going to stop. Then they are killed away, and then this wave starts again. So that can be a possibility of a immune system that is continuously activating and deactivating. So Sami Amin says, can you please tell us that once confirmed SARS-CoV-2 patient would be found negative using RT-PCR? Once confirmed SARS-CoV-2 patient would be found negative. Ideally, if I'm getting your question correctly, you're saying that if there is a person who is confirmed SARS-CoV-2, eventually they will become a negative RT-PCR. That is the thought. But again, the discussion of long hauler, imagine if we do not know that the long haulers have the virus in them living for a longer time, then they would not become RT-PCR negative. But ideally, they should become RT-PCR negative. Nancy is saying that it doesn't help that social media is shutting down videos content. Yes, I cannot imagine that they are removing my Periscope videos. They are taken down as soon as we finish, it's gone. Twitter has started removing my videos. Cool. Carol says, wow, ivermectin should be made available to all patients. Ivermectin should be made available everywhere. People should be able to, there should be a brochure that says, hey guys, if you're pregnant, don't take it. If you have a child who is young and you are lactating, don't take it. If it is a child lesser than 50 kilograms, don't take it. If you have any blood-brain barrier compromise, don't take it. If you have meningitis, don't take it. If you are unsure, please call here, or this person is sitting here in this stall, and talk with them, and they would explain if you should be able to take it or not. If not, then here is ivermectin pack. Please take it home and eat it and observe following things. That is how it should have been. we are just, I think I have been upset too much without any good outcome of all of this. Roller Girl, I think my videos have ivermectin in their title or such things, and they are honing in on words. So I think that they feel that if I have one video with ivermectin, then maybe my rest of the content is that way as well. So they just block them, remove them. Yes. So France, this video, for example, is on Periscope. Once it is finished, it would be gone. So they would say this broadcast is not available anymore. So they just remove it. Debbie says, thank you. That makes sense for persistence of virus with certain behavior of maybe some hiding from immune reaction, antibody, then trying to be active again. Repeat. Yes. Cool. Sami Amin says, my question is how long it would take to become RT-PCR negative. So Sami, this again is very subjective. Some people actually become negative within 10 to 15 days. Some people become negative about a week after their symptoms are resolved. WHO has simply a criteria, and that is once the chest X-ray has resolved and the symptoms have resolved, then do 2 RT-PCR back to back in 24 hours. And if they both are negative, then you are negative. Otherwise, wait again and do this a week later. So Emily, for the tinnitus, Dr. Drew's comment that fluvoxamine, he said within taking of the fluvoxamine, within a few, what did he say? Sorry, I'm just looking through his comments. So far, fluvoxamine amazingly stopped the tinnitus within 30 minutes for 3 hours after each dose. So probably it doesn't fix it fully, but it actually brings it down. So if it is making you nervous and upset and angry or frustrated, I know tinnitus can be really difficult to have and to work with. See if your doctor can think about fluvoxamine for you. Rima says, I see you on YouTube if I missed the live. Thank you, Rima. Okay, so his tinnitus and pulling to ground like quicksand is stopped by it until next dosage. Now he said earlier tonight. Yes, so he has a clear benefit from this. Jude says it is very unfair for top fans to ask multiple questions and the rest get dumped. Jude, tell me, what is your question? I have never tried to not look at the questions. So here is what happens. The comments are just moving, and I keep looking at the last 2-3 things, and whatever is there, I try to answer that. That is how I catch it. I try to sometimes scroll through these as well. My apologies, but it's not intentional. So here is a question from Jude. Is asthma a contraindication to getting COVID vaccine? Thank you. No. Allergic reactions are. So asthma is, of course, a immune-related disease, but I hope you don't have allergic asthma. That is a different thing than regular asthma. So if you have asthma, talk with them and say, hey, I have asthma. They may ask you to take some medicines before the vaccination. They may observe you after the vaccination, but asthma itself is not contraindication. It's just a flag to say, be careful when giving vaccine. Mary says, have you heard of using black walnut extract as antiviral? No, I have not. That is correct, Rima. And Jude, I didn't mean to ignore any. Nina says, what kind of teas you like? Is this a question for me, Nina? I actually like coffee. My wife has a full pantry of different kind of teas, and she is a tea fan. We go to Chinatown here in San Francisco, and there are various tea shops with various kinds of teas, and there are teapots, and these are made by artisans, and she looks at those teapots. She does a lot of things. She has magical teapots where if you put the cup, the tea starts pouring in. These are ancient teapots which are made up of earthenware, and they still have magnets in them to turn them on and off. So at most I take the black tea or green tea. She takes lots of kind of teas. Sepal Steve says, I think that the muscle paralysis drug you mentioned was atropine. Maybe. Sepal, I'll have to see what poison that was. And Professor Mulazim Hussain Bukhari, my teacher, in Pakistan, subset efficacy at preventing symptomatic cases, 74.8%, 100% at preventing severe disease. The IDMC did not report safety concern data. So, sir, which one is this? Is this the Sinopharm? I did not know this, Mary. Nina says, I thought you'd be a tea lover too. I used to take tea in my early age, but I am a coffee fan. Jana says that Dr. Bean is God sent. I think so. I was talking with Margaret today. Margaret, once again, she had a very generous donation. It is with Margaret, sometimes I discuss that I am blessed to have the opportunity to serve. Otherwise, there would have been someone, if not me. This is a big world. There are 7 billion people. There would have been someone that would have been serving. So I am blessed as well that I have the opportunity to come in and serve at this time. Kerry says, you guys should be careful about those mega doses of vitamin D. Cool. So Gold Country Russ says, green tea makes me itch. Rima says, you're amazing. Thank you. Excellent. So I think we can stop here for today. There are still a bunch of questions. Let's start again tomorrow. What we'll do is we'll do our regular little topic first, and then we'll do chit chat and do some questions tomorrow as well. So my Siddhartha is here as well. Thank you very much, Siddhartha. So Siddhartha says no one else explains as well as you do. Thank you. So let's do this. Yes, St. Clair, Dr. Merrick back. Yes, I had been in contact. He said he was visiting Texas. Then I did not get back to him, so I should reach out. So the customary message: if you like the work, please like, subscribe, and share. And there is a link to become my patron, and there is a link to buy me coffees, and there is a link to support this channel in general if you wanted to. So thank you very much. Let's take an off for today, and let's continue again tomorrow. Tomorrow we'll do the same thing. We'll do a small lecture, and then we'll do chit chat, and we'll continue with our discussions. Thank you very much. Stay protected. I'll see you tomorrow. Bye-bye.